Hello and welcome. My name is Jason Mazar-Kelly, and in today's practice we'll be working with a transformative breath practice called Anulom Vilom. This is a variation of alternate nostril breathing or the channel cleansing breath. It's a great practice to integrate into your morning routine, as well as for any time that you're feeling stressed or anxious. The benefits of this practice include improving lung capacity, clearing out the lungs. It's improving circulation as well as optimizing blood flow to transport those blood gases to the muscle tissues that we use to regenerate and regrow. And it's also a great practice to help soothe the nervous system, balance the nervous system, as well as repair or create new neural pathways throughout the brain between left and right side. So it's a great practice to revitalize, energize, and soothe, all in one. It's a beautiful practice. So I hope you'll enjoy this today. Let's get started. Come into a comfortable seated position, and I'm sitting cross-legged right now, but you can choose to sit cross-legged or kneeling, or you could even choose to sit in a chair if that's more comfortable. Anything that will help you create a nice long spine. If you need to, you can place a cushion underneath your seat if you're seated on the floor. That's just a nice way to help lift the hips above the knees. And then when you're ready, take a quick gaze around your room. Notice the space you're practicing in. Acknowledge any external sounds that may be a distraction. And then gently close your eyes. And as you close your eyes here, let the shoulders relax. Let the sit bones drop in to the base of your seat. And then let the diaphragm relax. Let the belly soften. So the diaphragm can move down deep into the belly as you inhale and as you exhale. So begin to deepen your breath, warming the lungs to help prepare for your practice. When you're ready and you've finished your next exhale, gently close off the right nostril and begin to inhale through the left side. As you reach the top of your inhale on the left side, hold the breath in and count to 7. 1, 2, 3, 4, 5, 6, 7. Close off the left nostril with the ring finger or pinky, and exhale through the right side. Inhale through the right side. And again, when you reach the top of your breath, hold the breath in for a count of 7. 1, 2, 3, 4, 5, 6, 7. And then close off the right nostril with the thumb and exhale out the left. Finish your exhale. Inhale back through the left side, filling up. And again, when you reach the top of your inhale, hold the breath in. This time we'll count to 8. 1, 2, 3, 4, 5, 6, 7, 8. Close off the left nostril with ring finger or pinky and exhale through the right. Again, when you finish the exhale, inhale back through the right side. And at the top, hold the breath in, again, for a count of 8. Counting this time at your own pace, and if you'd like, you can let the hands rest in the lap as you hold the breath. Again, when you hit that count of 8, close off the right nostril and exhale through the left. And then repeat this process, inhaling through the left side. At the top, holding the breath in. This time you'll increase that baseline count to 9. And then when you reach 9, you'll exhale out the right. And you'll continue side to side here at your own pace, trying to slowly and steadily increase that baseline count. Now, as you continue in your practice here, you may eventually get to a point where you increase that baseline count. Maybe it comes at 15 seconds, maybe it's at 20 seconds. But you'll start to notice this hunger for breath, this need to breathe, the body responding to holding the breath. When that happens, feel a little wave rise, and then release the breath and stay with Anulom Vilom, alternating nostrils. And when you hold the breath each time, just approach back to that baseline. So whenever you start to notice that hunger, you keep the baseline steady there. And if you feel like it can be expanded, then you can always expand it. But we don't want to force this breath. We don't want to be gasping for air when we release the breath retention. So make sure that there is that element of ease that's maintained even as you increase the baseline count. We'll continue here for a couple more breaths in silence. Every time you hold the breath in, try to soften around the holding. The shoulders relax, the spine grows long, the sit bones soften. And every exhale with control, letting it go. Whatever nostril you're on, take one last inhale. And at the top, hold the breath in, going back to hold to the baseline count. Again, maybe you're at 15, maybe you're a little lower, a little higher, wherever you are, it's totally perfect, just right for you. And then when you reach that count this time, release the breath through both nostrils. As the breath flows out, the shoulders relax and start to come back to your natural 3-part breath. And as you come back to your breath here, feel free to take a little wobble in the waist, a little roll of the head and the neck side to side as you come back to your day, feeling, integrating the effects of Anulom Vilom, transformative, channel cleansing breath. And then when you're ready, take one last big breath in together here, filling up. Hold the breath for a moment at the top as you lengthen the spine, open the chest, feeling the day ahead. And then exhale, let it go with a sigh. Take a moment, honor yourself. A little smile asana if that would feel good. Bring some positivity into your day. And you can slowly begin to open your eyes and greet the day, hopefully feeling refreshed and renewed. Again, this practice is called Anulom Vilom, variation of the channel cleansing breath. I hope you enjoyed it. I hope you found benefit from it. And I look forward to practicing with you again. Thank you. Have a wonderful day. And I hope you find your center.